everyone. Today I'm going to talk about Module 67, which is on mood disorders. So, after a traumatic event, it's very normal to feel down and to conserve energy. Our emotion is kind of like a compass that tells us what to do. So, after something hard happens, it's like, yeah, that was really hard. I think I need to take some time to recover. But the difference between a normal response to something stressful or traumatic that's temporary versus a depressive disorder is like the difference between feeling out of breath after running or feeling chronically exhausted. So, about 31% of college students say that in the past year they felt so depressed that it was difficult for them to do something. Major depressive disorder is when you have a period of 2 weeks or more where you experience five symptoms from the following list, but at least one of the symptoms has to be either depressed mood or like loss of interest in things that you enjoy doing. So the symptoms are depressed mood most of the time, reduced enjoyment and pleasure in most activities most of the time, significant trouble regulating appetite and weight, significant trouble regulating sleep, agitation or lethargy, listlessness or just having less energy, feeling worthless or feeling unwarranted guilt, trouble thinking, concentrating, or making decisions, and thoughts of suicide. So, five of those symptoms within 2 weeks. Persistent depressive disorder is a little different. It's a period of 2 years or more where you have like more mild depressive symptoms. So, same kind of symptoms, but it's just like less less intense for a longer period of time. Bipolar disorder is a little bit different. It kind of alternates between these depressed moods, a normal state, and then mania. So, but these aren't like crazy mood swings that happen like within like a day or like a week. It's more like longer periods of time in each state. So if you have one of those states in like 6 months, for like a 6 month span, you like hit all three, then it's like bipolar disorder. So we know what the depressed state looks like based on like the major depressive disorder. For the mania, that's like extremely high energy, extreme optimism, and often like poor judgment. So sometimes that leads to like risky behaviors or crazy expensive purchases, but they don't like to be questioned or argued with or like reasoned with during this stage. So they're kind of like, they're not really open to questioning any of those poor decisions. They find that actually this cluster in the brain that like is associated with creativity is a risk factor for this. So making it like the only psychiatric disorder that kind of correlates with these creative professions like artist, musician, poet, because I guess that like area in the brain helps us with creativity, but it's also like correlated with this disorder. So sometimes during mania it actually like feels like really good creative works, but yeah, the disorder, although it's less common than major depressive disorder, it is like twice the number of lost work days. It can just be very difficult, and there's a high risk of suicide involved. For major depressive disorder, more women than men have it, but for bipolar disorder, it's about equal. Next is the disruptive mood disorder, and that's, or disruptive mood dysregulation, sorry. It's like irritability and kind of like outbursts. So sometimes like before they diagnose people with bipolar disorder who probably actually had disruptive mood dysregulation. Yeah, so some more things about like the brain and bipolar disorder. During states of mania, energy consumption in the brain is a lot higher, which makes sense. Also, the levels of norepinephrine and serotonin are high during mania and low during depressed times, and they're also low for people with major depressive disorder, which makes sense. Some drugs can like inhibit the reuptake of these neurotransmitters, which can like help people feel better. Exercise also naturally produces these neurotransmitters, so that can help. Um, the book said like if you want to run away from a bad mood, you can use your own 2 feet. Um, Depression can involve like some sort of like tendency for these certain thought patterns that are kind of like self-deprecating, negative explanatory style, rumination, which is just overthinking problems and their causes. Um, Sometimes comparison on social media does not help with that. And yeah, it's kind of like this cycle because a bad event combined with a pessimistic thinking style results in depression. And then when you're depressed, sometimes that makes more bad events happen because the people around you sometimes might like reject you because you're like super down, or like your boss might like lose confidence in your like abilities because you're really like having a hard time. But that can lead to more like things like losing your job, and then the cycle just repeats, another stressful event plus like more depression. So um yeah, it's pretty difficult. um Normally it does like get better, but yeah. The next thing is like suicide. So they kind of do studies. They find like certain times of year, days of the week kind of have stronger like rates of it. Usually it's like people feel like they have a lack of belonging and they aren't having an impact on others. Maybe they feel like a burden. Maybe they feel just like a lack of purpose. But there's also non-suicidal self-injury, which is like hurting yourself but not like killing yourself. So reasons for that could be like distraction from negative thoughts, trying to get attention to try and like get some help for something that you're struggling with, um, or trying to kind of like relieve some guilt by like punishing yourself, or maybe you're trying to like end the criticism or bullying from somebody else, or trying to like fit in with some sort of trend. Um, it doesn't usually mean that someone's going to commit suicide, but it's still like shouldn't like ignore it either. And it's usually like people who do non-suicidal self-injury usually have like poor communication skills and problem solving skills, so this is kind of like the only way that they can like try and deal with their problems. um, yeah.